Hello and welcome back. This is Dr. Michael at Page Chiropractic and Wellness Center. On today's segment, I wanted to cover a little bit more about car crashes, car accidents, and specifically whiplash injury of the head and of the neck. There are some very specific injuries which take place and some very specific treatments which must be administered to the patient in order to receive 100% effectiveness in the therapeutic value of all the treatments that are given. You know, there's a lot of things that can be done after a car crash in physical therapy, chiropractic, and other realms. But today I want to talk about the actual muscles themselves, what occurs, how they heal, and the type of treatment that you should be receiving in order to receive a maximum benefit. As it turns out, the majority of people, 50% of all whiplash injuries do not heal properly, and they leave patients with some form of chronic pain. Headaches, neck pain, back pain, at times tingling and numbness going down the arms. And a lot of this comes from the fact that the muscles themselves in the neck are injured. Now, from a soft tissue standpoint, muscles have a grain to them very similar to wood. And in a whiplash injury, those muscles are actually ripped or strained, and that causes a ripping or a change of the configuration of the muscle that looks something like this. Your body is going to attempt to heal that. When it does that, it's going to lay down scar tissue. As long as that scar tissue goes with the grain of the muscle, then your muscle will retain its elasticity, and you'll be able to go forward in your life without long-term pain. However, if the scar tissue goes across the muscle, then what you're going to end up with is an area of pain. And some people know of these as trigger points or long-term trigger points, and they're points in the muscle and the shoulders and the neck where it hasn't healed properly. And as you go throughout your life, you have stresses and strains of life. That's the area that it will attempt, or your body will just be attacked by the stresses of life. Those are the types of people who, after a car crash, years after, have the chronic pain symptoms, sometimes even spreading throughout many parts of the body, and they get diagnosed with things as rare and as weird as fibromyalgia and other types of muscle myofascial pain syndromes. And so what needs to happen is a very specific type of therapeutic exercise needs to take place for that scar tissue to lie with the grain of the muscle. Also, there are some other therapeutic adjuncts that I use in the office, and sometimes I send home with people. Movement in general is very, very important, but a very specific kind of therapeutic movement is really, really important, as well as some very specific stretching. If you have been in a car crash and you are receiving this type of therapeutic thing, that is perfect for the muscle. There are other parts that are injured, such as the joints and the ligaments and things. Those require different types of treatment, but the muscles themselves require that. Massage can be helpful in aiding in this as well, but only to a certain point. You must combine all of this together at the same time. So I urge you, if you're not getting that, please call the office at 801-733-8300, and we'll give you a second opinion as to what you're doing, if it's correct or not. And I believe most people do get correct treatment, but you want to make sure that you're having this very specific type of therapeutic exercise. Hope this has been helpful. You can always visit us on the web at www.pagecw.com. That's Page Chiropractic and Wellness Center. Hope this has been helpful. Best wishes to you, and we'll talk to you very soon. Thanks.